I'm Maria Yasnova. I'm a lactation consultant and a breastfeeding counsellor with one of the international breastfeeding charities. I wanted to share a few pointers with you on how to get the baby onto the breast as comfortably as you possibly can and even improve the latch further if you're not feeling 100% pain-free. It's possible to feed the baby without pain, and it's certainly something that is actually quite pleasant if your nipple is not getting compressed, traumatized, pinched, and you are relaxed and leaning back. So the few main principles that are common to any position you choose to feed your baby in. If you imagine that your breast is round, as it is, the baby needs to take the breast from underneath, so they approach the breast with the chin forward. So you bring the baby to the breast and plant their face, chin coming forward, and that actually allows them to drop their jaw as low as possible. You can also then have your thumb pressing above the nipple, so the nipple is even more protected and it's not going to be pointing into their mouth, which will allow them to climb quite a distance up onto the breast before they reach the nipple. It's really deep this way, and the nipple is sitting in the depth of their mouth, pointing to the head, top of the head, without being compressed. So the baby comes as deep, as low as possible under the breast. The shoulder blades are supported. The thumb is pressing next to the chin if you want to help it protect a little bit more if it's already quite sore. And then you scoop the breast with the baby's mouth, and then you lean back and kind of get the gravity, support the baby further down on you. If it's still painful, if you find that that's still not quite right and the pain is maybe about 5 out of 10 or higher, there are a few things you can do to minimize that pain there and then. Avoid unlatching the baby and starting again, simply that you're risking to stress the baby out, distress the baby, and then eventually accept the pain and feed through it, which is never a long-term solution. So to fix the latch, you can always put your baby's your thumb next to the baby's top lip where they're on the breast, and just press down and feed more breast into their mouth. You can then also use your other hand, if you swapped your arms, use your other hand and find the baby's chin touching the breast, and then you use your finger and literally scoop the breast and drop it in, and just keep feeding it into the baby's mouth, just millimeter by millimeter, moving that nipple further in. It just allows you to have a little bit more breast tissue in their mouth, and the pain should be gradually reducing. Always lean back. Leaning back means that the baby is planted on you with their face down, which keeps their mouth open as wide as possible. Sometimes mothers find that the baby is sitting quite high above the breast, sort of almost in the armpit, which means that they have to look down and bend their neck to find the breast somewhere down below. That's very difficult for them to open wide because they're bending their neck down. All you need to do in this case is just scoot the baby slightly more round underneath the breast again, so they start tipping their head back again and trying to look up and latch on. If it still hurts, you can apply a bit more pressure on their shoulder blades so the head tilts back and the baby is finding themselves looking more up to the ceiling. You can also rotate the baby's position under the breast so that effectively the whole breast is supported by the baby's face, and that also drags the chin down. So that's just a few pointers to get that latch as deep as possible. And then if you need any further help, please reach out. There are quite a few opportunities to get free support, whether it is from La Leche League, ABM, Breastfeeding Network or NCT. There are quite a few helplines, and if you want to connect one-to-one, please look up Lactation Consultants Great Britain, where you can have a session with one of the lactation consultants one-to-one via Zoom and have all your difficulties with regards to breastfeeding addressed, and help you get on your way with comfortable and pleasant breastfeeding. Enjoy your babies, enjoy your baby moon.